The Ottawa ankle rules indicate x-rays needed after an acute injury if there's pain and any one of the following: inability to bear weight for 4 steps immediately after the injury or in emergency department, bone tenderness of any of the following locations, distal 6 centimeters of the posterior edge of fibula or tip of the lateral malleolus, distal 6 centimeters of the posterior edge of the tibia or tip of the medial malleolus, base of the 5th metatarsal, tenderness to the navicular bone. Test item cluster for patients likely to benefit from spinal stabilization exercises include age less than 40, average straight leg raise greater than 91, ambient motion, which includes instability catch, painful motion, Stewart-Gower sign, reversal of lumbo-pelvic rhythm, and a positive prone instability test, which I'll show you right now. Alicia's going to lay on her stomach, and then I'm going to apply pressure to her lumbar spine, ask if there's any pain with that. Then I'll ask her to lift her legs up, and then I'll apply lumbar pressure again to see if there's any pain with that, and ask her, and then test item cluster for patients likely to benefit from spinal manipulation includes current episode of pain, 16 days or less, no symptoms distal to the knee, FABQ work steps score 18 points or less, at least 1 hypomobile segment with motion testing, 1 or both hips with 35 degrees of internal rotation or more. The McMurray test checks for meniscus pathology. First, I'm going to check for the medial meniscus. Do that a couple times. And then next I'll check the lateral meniscus. The anterior drawer test checks for ACL integrity. The slump test, a neural tension test. All right, Alicia, so I'm going to get you to bring your arms behind your back. You're going to slouch for me and go ahead and bend your neck forward all the way to your chest. I'm going to apply some overpressure, and then I'm going to extend your knee and then dorsiflex. And then I'm going to ask you to bring your head up and then see if there's any symptoms that change, and I would do that on the other leg as well. Test item cluster for identifying hip OA includes patient reports squats aggravate hip, active hip flexion elicits pain on the lateral side of the hip, active hip extension causes hip pain, patient's passive hip internal rotation is equal than or less than 25 degrees, and the Scours test causes growing or lateral pain with adduction. The Faber test checks for hip and or SI joint dysfunction. The anterior drawer test of the ankle tests for the anterior talofibular ligament integrity. Differential diagnosis of gluteal and hamstring weakness versus L5 and S1 radiculopathy. Gluteal and hamstring weakness includes isolated weakness in hip abduction, external rotation, and extension, isolated hip flexion weakness, positive Trendelenburg sign, which Taylor will demonstrate right now, normal reflexes and sensation, hip active range of motion deficits due to weakness, but full passive range of motion is present. L5-S1 radiculopathy may present with pain radiating into lower extremity, sensation deficits in L5-S1 dermatome, myotomes weakness in plantar flexion, knee flexion, and great toe extension, diminished or absent Achilles tendon reflex, positive straight leg raise test, positive well leg test, which I'll demonstrate right now. Patient may experience symptoms with a straight leg raise on this leg and may experience symptoms on the opposite leg with the well leg test, and a positive slump test, which was demonstrated earlier. Abnormal imaging may show disc herniation.